Mr. the President of the panel, honorable members of the panel, good morning. First of all, we would like to thank you for the opportunity and the honor you have done to us to present you our work topic on the predictive value of urinary dipstick abnormalities for raised serum creatinine in patients admitted into the emergency ward of Douala General Hospital in Cameroon. This translation is supervised by Associate Professor Flavian Malachon. To do this work, we will follow this outline. We will start with an introduction followed by our aim. Then we will present you our methodology, followed by the result and our discussion. We will continue with the conclusion before ending by the recommendations. As in introduction, we can say that kidney diseases are frequent and represent a worldwide health problem. Glomerular filtration rate estimation is the main tool for the diagnosis, and serum creatinine is the most used biomarker of kidney disease diagnosis. But the problem is that this serum creatinine need a very high laboratory equipment for his realization. A trained personnel and is unavailable in many hospitals. And the other problem is that this tool detect another problem is that this tool detect this kidney function dysfunction at late stages. But we have urinary dipstick test, which detect early urine abnormalities from kidney dysfunction. This tool is easy to realize, cheap, and available in every hospital. Then we need to know the utility of urine dipstick abnormality for predicting serum creatinine elevation. In our work, we have some operational term definition. We have defined abnormal urine dipstick as the presence of proteinuria and or hematuria and or leukocyturia in the urine during the urinary dipstick assay. Serum creatinine elevation was defined as serum creatinine more than 12 milligram per liter in women and more than 13 milligram per liter in men. Positive predictive value was defined as the probability of a patient to have elevated serum creatinine when urinary dipstick was abnormal, and negative predictive value was a probability of a patient to have a normal serum creatinine when urinary dipstick was normal. Our aim was to determine the predictive values of urinary dipstick abnormalities for raised serum creatinine at emergency department of Douala General Hospital in Cameroon. For this aim, We have conducted an analytical cross-sectional study during 3 months from 13th January to 13th April 2017, and we have included all patients aged 18 years and above. For each patient, we recorded clinical parameters, collected 10 milliliters of urine for urinary dipstick analysis, and collected 5 milliliters of blood for serum creatinine assay. Mr. the President of the panel, honorable members of the panel, our result. We have included 401 patients. The mean age was 49.3, and men were representing in 55.4%. As far as concerned comorbidities, hypertension was the most frequent with 38.4, followed by diabetes, and the last one was HIV. About drug consumption, the most frequent was non-steroidal anti-inflammatory drug with 27.9%, followed by traditional drug, and the last one was anti-hypertension drugs. About the prevalence of dipstick abnormalities and raised serum creatinine, we have found that 61.1% of our population had proteinuria in urine, followed by hematuria, and the last one was leukocyturia. 35.2% of our population had elevated serum creatinine. About predictive value, we have found that abnormal urinary dipstick had a negative predictive value of 19. It means that patients with abnormal urinary dipstick had 19% to have normal serum creatinine. According to the risk factor of kidney disease, we have found that for the patients who had no risk factor of kidney disease, they had a negative predictive value of 92.3. It means that a patient who had no risk factor of kidney disease had 92.3 92.3% of to have a normal serum creatinine when urinary dipstick was normal. For those who had risk factor of acute kidney disease, they had a probability of 90.7 to have a normal serum creatinine when urinary dipstick was normal. When we associate risk factor of acute kidney disease and chronic kidney disease, they had a negative predictive value of 94.2. We can see that positive predictive value was law about all those patients as far as concern those with no risk factor, those with acute kidney risk factor, and those with chronic kidney disease risk factor. Mr. the President of the jury of the panel, honorable members of the panel, our conclusion. We conclude that a normal urine dipstick strongly predicted normal serum creatinine in patients with no risk factor or kidney disease. About our recommendation to the physicians, we recommend to systematically realize urinary dipstick test. And if there is no risk factor of kidney injury and normal urine dipstick, to do not do serum creatinine assay. To the scientific community, to continue research in this field by including other urine parameters such as urinary osmolarity and urinary sediment. Mr. the President of the jury of the panel, Mr. the President of the panel, honorable members of the panel, we are at the end of our presentation. Thank you.